Hi, this is Dr. Heather Hammonds at Restore Regenerative and Sports Medicine. And today we're going to talk a little about Shockwave in general and give you a little more information and see how it might be applicable to you and your needs.
Dr. Hammonds, what exactly is Shockwave therapy and how does it work?
Our Shockwave system is right here. It's mechanical sound waves that stimulate healing at the cellular level. What we see with that is increased circulation. It breaks down your scar tissue, reduces your pain. It can be used for both acute and chronic issues and really has been a game changer. Specifically, it can be used while you're in season, so it really kind of keeps you in the game, keeps you from having to have significant downtime.
What's the difference between radial and focused shockwave therapy?
True shockwave is focused, and so that's our one up here on top. This is the one that goes actually back well into even the 1980s. This is where that technology started out kind of in more urology with kidney stones. So what that one does is specifically when we have specific pathology, it allows us to treat that specific pathology, or that be specific to your tendons, your bones, your nerve tissue. Radial is more treating a wider area. So that can help us to release tension on muscles around. It can be also used into that specific area, but we definitely get a better treatment with our focus.
Not all shockwave devices are created equal. What makes Restore's equipment superior?
So we have done a lot of research into the specific types of shockwave that are available, and we ultimately landed with the industry standard, which is Storrs, which goes back to actually Dr. Carl Storrs, who was really the trailblazer and founding father of the technology and understanding of shockwave being applied in medicine. Where a lot of your research is actually, it's the Storrs unit that they use. So many units may extrapolate that data, but it is ultimately, most of the research is done off of the Storrs specifically, with it being the industry standard.
Can you share a bit about your training and certifications in shockwave therapy?
I can. I'm happy to announce that myself and Ginger Wright, our physical therapist, are both certified in the International Society of Medical Shockwave Therapy. I myself am board certified sports medicine. I've been practicing over 10 years. With that being said, I'm trained specifically in musculoskeletal medicine and able to assess to see if you are an appropriate candidate for these type of therapies.
Perfect. Why is it important to work with someone who understands the musculoskeletal system when getting shockwave therapy?
So shockwave therapy is a medical device, and it is a true treatment. So this isn't grabbing a Theragun and using that on your, to release some tension. This is providing an actual therapeutic intervention. So it's important to have a deep understanding of the musculoskeletal system. Oftentimes I have people come to me who say they may have hip pain. There's definitely a lot of referral patterns, and so if you do not have a deep understanding of the musculoskeletal patterns, it's a good chance you're going to be wasting your time and money as someone's hunting down a specific spot you think you're hurting, where lo and behold, it may be coming from your back, within the shoulder, sometimes that's coming from your neck. So you may be spending a lot of time pouring a lot of money into a treatment, and they may not even be treating the correct area.
Speaking of, what are some of the most common conditions you treat with shockwave therapy?
As a runner myself, since I brought on shockwave therapy, it has significantly reduced any chance of any injuries that I have, as well as my fellow runners. So with that being said, foot issues, Achilles, plantar fasciitis, tennis elbow, generalized neck pain, back pain, shoulder pain, even like partial, rotator cuff injuries, and even neuropathy. So peripheral neuropathy and entrapments can be treated with a deep understanding of what specifically is going on.
What makes Restore the best place to get shockwave therapy in our area?
We have an excellent lineup. We did recently bring on our electromagnetic transduction therapy, EMTT. So this is using now magnetic science to really help a lot of acute pain and chronic pain. Can be used before surgeries, after surgeries to help your healing. That also is used ahead shockwave. So using this ahead of time can make that treatment a little more comfortable. With that being said, again, industry standards. So we have top of the line equipment that we use. We have a deep understanding of what we're treating and what's the appropriate, being realistic that what are your expectations when you're done, and I'm always cognizant of, is this appropriate, if you are in season and wanting to have minimal intervention so that you can continue to play, we'll work with you on that. But we also have a plethora of different techniques and different services that can be used beyond our Shockwave, which we often pair. So if I'm doing some of our more advanced treatments such as PRP or cell therapies, Shockwave's always partnered with it because they play excellent together and really are helping you to get your best outcomes. Part two sets us apart is I'm ultrasound guided trained, and so I use the ultrasound. We use that for guidance to be able to sort out where specifically your injury is. If it's in the shoulder, I know exactly where that specific pathology is. So our treatment is very precise to give you your best outcomes with that. And in general, our patients don't just get a treatment, they get a plan to their healing.
Thank you.